and welcome to this overview of Senior Access Points of Larimer County. I'm Cheryl Noble. I am the project coordinator for this larimerseniors.org, and I wanted to put together a quick little introduction and overview of the background and what Senior Access Points is about. Normally we would do an in-person presentation, but we are in the virtual electronic age of COVID, so we have this tutorial that I put together. Why Senior Access Points? When a survey was done a few years ago, we found that many older adults didn't know where to turn when there was a crisis, and their family members also needed to find some information, and that there's quite a bit of resources out there in our county, but they weren't organized, and it was challenging to find where those resources were. And so the website evolved to provide an entry point into getting people started with their research in one complete website where they can find a variety of resources that's offered throughout our county. I mentioned the survey, which was done in 2017 through the Health and Wellness Priority Group in Partnership for Age-Friendly Communities. And you'll see that, and not too surprising, that declining health issues was one of the top reason for people looking for resources, and that the caregiver resources was closely behind. And while the survey was done a few years ago, we're finding that these issues and reasons haven't changed that much, with the exception of perhaps caregiver has increased through the years, and that is still up there. But people are still needing these resources, and for the reasons that they're looking for them, and the places that they're looking for them is the Office on Aging and their doctor's office. And a big part of it is the online search, which a lot of out-of-town family members are using. What we've also found is that even though people may be in a crisis and they need resources, there's a lot of reasons why they don't. There's some barriers because they don't want to feel that they want to ask for help. There's also, they don't know where to go. They're not familiar with technology, and family members out of town, so they don't want to ask people around them, and they're just feeling lost and don't even know where to start. And with the website, our big effort was to help get the word out and awareness of this website so that people got familiar with the website and knowing where to go when they needed help, and hopefully even before they needed help, so they could get familiar with all the various information and services that are out there. And the categories that we created in the website matched what the survey showed us with regards to the resources that people needed. Again, the health being the number one, declining health, the reason for looking for resources. And then we also have care for the caregiver as one of the resources as well. And so we have all these categories, and you can see that we had also updated it. We keep the website updated with COVID information and vaccine information as well. And we've created 2 tabs that help people find information very quickly on where the testing and where the vaccines and how they can register. One of the big resources that is offered is the Office on Aging. Their phone number is given on the website that directs people to an options counselor, and that they also provide a guide, a resource guide, which didn't get printed last year because of COVID, but the The previous guide is still available, and it's filled with a variety of resources as well. And that gives people another level of information for them. Another resource is the network of care that Office on Aging provides. That is also on Senior Access Point's website. And that gives people an opportunity to take their search a little bit deeper, while Senior Access Points is an entry level with basic information. These two pieces of resources give them more in-depth information that they may need. We created, through grant money that we got, some marketing materials. On the left is a rack card with the website, larimerseniors.org, plus the phone number to the Office on Aging and an options counselor. And what the options counselor does is help connect the caller with resources that they need. So it's a personal connection with resources, and it customizes it to specifically what they're looking for. On the back side of that rack card, we included some very basic guidelines to helping people prepare for caregiving, because as we know, that is one of the top reasons that people look for resources and information. We also created business cards, and we also created Spanish language resource cards as well, and our website also includes Spanish resources. Part of our outreach program in educating the community about larimerseniors.org is our ambassador program, which is made up of volunteers who would deliver the rack cards and magnets to various places where people would frequent, and that was another means of getting the word out about larimerseniors.org. We had a booth at the farmers market, and we would give out information and answer a lot of questions. And we also then took the outreach to our rural areas so that our residents who lived on outside of the city limits were also aware of where they can go for help, primarily the Office on Aging and an options counselor who could help them. We did a lot of events and fairs and community meetings, book clubs, and really diving in to the core of the community where we could reach people and talk to them about older adult services for them. Now that we had to adapt with the COVID, we took more creative approaches since we couldn't get out in the public. We did radio spots and PSAs, social media, we did ads, and then we were at the farmers market again as part of the Market Days program, which provides fresh produce for older adults in our community, and they were delivered this year. But our booth also was a point of resources and being able to give out information there as well, and of course wearing masks. Just wanted to point out real quickly with the outcomes, we do track the materials that are given out. We also have analytics on our website that show us how much the website is getting used and how where people are, what pages they're going to. You can see in 2019 was a huge year with all of our outreach that we did of really delivering materials out to the community, getting those magnets on the refrigerators so people could quickly refer to it when they needed to. And then in 2020, we had the big drop off with the pandemic. But with the website, we did see an increase in that, and a lot of that was contributed to the new outreach that we did with the different media, the radio and ads that we did. So I hope that that kind of gives you a little bit of information on larimerseniors.org. And please reach out to me if there's anything that we can help you, support you in any way in getting the word out. If you have any questions at all, please feel free to contact me. I'm Cheryl Noble, and my website is there for reference. And thank you so much, and please help us with larimerseniors.org. Thank you.